Well, lots of us skip a trip to the doctor's office and use a virtual visit instead, but expanded telehealth is now at risk for many patients with Medicare coverage. It could end actually in just a few weeks. NBC Connecticut's Matt Austin is live at the state capitol with new calls for action. Hi, Matt.
Yeah, so Amber, there are hundreds of thousands of people here in Connecticut who rely on Medicare. And today we heard support from lawmakers and others about keeping this expanded telehealth going. People with Medicare could see expanded telehealth coverage expire at the end of this month.
For a lot of our patients with disabilities, a lot of our elderly patients, it either becomes a transportation mobility problem, and it's either we see them via telehealth or not at all. And I would really never want anyone to go without care.
Telehealth really exploded in 2020 during the pandemic. That year, nearly 15 million people with Part B Medicare used fee-for-service telehealth in the U.S., representing nearly half of eligible beneficiaries. You can see it's dropped in the years since, but last year was still at 25%, or about 6.7 million users.
Connecticut made telehealth permanent because of its success during the pandemic. It improved access to so many people, not just in Connecticut, but around the country.
We're told in March coverage was extended to September 30th, and there are concerns if it will happen again. If not, that could mean the virtual care would be restricted again to rural areas and only certain services.
It helps our patients, it helps the outcomes of the patients, and this is going to be a lifeline for so many people, and we have a responsibility to make sure that we continue on this path.
Now the focus is on Washington. There are several bills moving through Congress to get this done, and there is bipartisan support. Live at the State Capitol, Matt Austin, NBC Connecticut News. Amber, back to you.
All right, Matt.